a year and a half ago actually, we looked at the breast cancer patients in Saudi Arabia, and we focused on brain metastasis from breast cancer. As you know, brain metastasis can be one of the worst factors or one of the worst types of metastasis in any type of cancer affecting patients. Why did we choose this? Because breast cancer is one of the most important malignancies in KSA. It is the most common malignancy among Saudi women. It's also expected to increase with 350% its incidence and the mortality by 160% by the year 2025. So this is very close. Of course, these figures are compared to the time the study was conducted. This study was conducted in 2008. So we are short of time. Time is running, and we are expected to have a very huge number of breast cancer patients in KSA in the coming years. So worldwide, breast cancer is the fourth most common cause of secondary metastasis to the brain. Other causes are more common, but breast cancer is important too. Worldwide, 10 to 15% of breast cancer patients have brain metastasis. That is based on several different studies, mostly from the Far East and the West, and most of them had this range of 10 to 15%. As we will see, this is a very important number, so please keep it in mind. And of course, as I said, the mortality and morbidity is very, very important. So due to time, I had to just mention a few things that we did. These are the most important parameters we looked at: age of diagnosis of breast cancer, stage at the time of diagnosis, receptor status, and histological subtypes. We did look at several other factors such as therapy given, date of diagnosis with several different other things, but these are the most important and main things we looked at. Of course, this is based on previous studies, as you can see here. Brain metastasis from breast cancer, I think most of my colleagues from KSA would know that breast cancer is very, very well studied in the kingdom. A lot of studies about breast cancer, but brain metastasis, we almost had no studies about it from breast cancer. We know that Saudi patients get diagnosed late based on one study before that was conducted a few years ago, that most of breast cancer patients are diagnosed at stage 3. It was a very high number. I'm sorry. We have genetic factors and other factors, mainly in the culture. Patients sometimes are afraid of being treated, or they seek other options other than medical treatment. So we did look at these things. So as I said, we wanted to estimate the proportion of breast cancer patients and to compare it to the number 10-15 to 15%. We wanted to know if we have the same number or if it's different, as we will see in a few moments. We also wanted to know the predisposing factors for brain metastasis. What can cause brain metastasis in our patients? And is it the same worldwide, or do we have other causes that our doctors need to look at and make sure that they don't happen? Sorry if I'm going too fast, but this presentation is usually given in 40 minutes. Our patients were identified from January 2002 to July 2009 from a database of breast cancer patients in King Abdulaziz Medical City. Basically, our sample was every patient diagnosed with breast cancer during this time period. Then we included everybody, every patient who was diagnosed with brain metastasis. We excluded everyone else who didn't have brain metastasis. We studied the characteristics, pathological features such as histology and receptor status, prognostic factors, and we analyzed using Kaplan-Meier and proportional hazard progression model to see the effect of different subtypes of cancer, of breast cancer, and what they cause. So I have 2 minutes to go. 594 breast cancer patients. The median age is 39, and their age was 26 to 69. The total was 34 patients. Median time to CNS metastasis was 16 months. As you can see, there's a very wide range, and Remember, 10 to 15% worldwide. In KSA, it was 5.72%. Maybe in the discussion, please, someone can ask me. I can't explain that now. These are the types of cancer that were found, the histological subtypes. Nothing different from the literature. Prevalence of different types of breast cancer, normal. Receptor status, this usually takes 20 minutes, but basically HER2 is the most important, and triple negative breast cancer is also, they are both very important. ER, PR are less important. 34 patients had brain metastasis, as I said. Most of them had intraparenchymal, and leptomeningeal wasn't that much. So finally, we have 5.7% brain metastasis from breast cancer. And this needs further investigation. Someone else other than the first one, please ask me about this too. And they were 6 years younger, so age might be a factor. And typically they had invasive ductal carcinoma, which is not surprising because it is the most common cancer. Half of the patients had HER2 cancers. Triple negative had the worst prognosis. I didn't include the results for that. A third person can ask. Intraparenchymal lesions are more common, and our patients were different, of course, as you can see. Of course, for the limitations, the number of patients was only 34, as you can see. Missing information patient charts, this is a retrospective chart review, and it was one single center. So I have 6 seconds. Thank you.
Thank you very much. Sorry if I'm a cause of stress